Why do doctors request for these scans? So, number one is, of course, for us to know the size and the location of the tumor. And another one, if it's going to influence our management of your case. If you want to go all natural, go for the therapeutic dose, right? So if you're already going on a therapeutic dose, and most of the time, these natural therapies don't really have much side effects. So the risk actually of taking these supplements and natural food is really low, right? So if you are already on a cancer protocol with this, then it's not really necessary to do the scan anymore.
Hello everybody, welcome to another episode of Simply Heal. And today we have our Dr. Jansen with us.
Hi, glad to be here again.
Yeah, today we're going to be very excited. Doc, I have very good questions for you that I think our viewers are very interested in, which is diagnostics, scans. What kind of scans do we need for cancer patients? You know, we have those CT scans, MRI scans, and these scans can be so expensive. So Doc, today we would like you to enlighten us. Okay, for a cancer patient, what kind of scans are necessary? You know, I really realized this, Doc, that sometimes when we walk into the hospital, right? Guys, I mean, our viewers out there, you know, sometimes we are afraid. It's like, do we really need these scans? Is the hospital just billing me for standard scans? Do I really need this? Doc, we hope that today you can share with us and enlighten us. What are the scans for? Are they really necessary at all?
Yeah, okay. So, the scans that we have right now, the imaging tools that we have right now for cancer are ultrasound, X-rays, CT scan, MRI, PET scan, and the nuclear imaging tools. Okay, so we have a lot of tools that we use. So each functions differently, but the basic principle is almost the same. It's to take a look inside your body so that we know the size of the tumor and the location of the tumor. Okay, so let's go to the basic stuff first. Ultrasound.
Ultrasound.
Okay, so ultrasound uses sound waves basically to know. It acts like a sort of a sonar. Okay, so in order to locate the tumor, the size of the tumor.
Is it expensive, ultrasound?
No, ultrasound is not really super expensive. It's fairly cheap, but of course,
It's like 1,000 plus, right? Or
yeah, it's 1,000 plus. It ranges from 1,000 to 5,000.
Okay.
Depending on the institution where you are going to do the ultrasound, no? So basically, what we see inside the ultrasound, if we are looking at the tumor, if the tumor is if the mass is solid or liquid inside. If the mass is solid, then it comes out as a hyperechoic. Hyperechoic. So it sort of like a gray image in the ultrasound. If inside the mass it is water, then it returns as a black circle.
So what is good?
Ultrasound.
You want it to be black or you want it to be gray?
Okay, you want it to be black because black is if it is black, then it is probably benign.
Oh, wow.
Okay, if it is solid or in medical terms hyperechoic, then that is more of a malignant character. But of course, to know really for sure if it's malignant or not, then we have to take we have to do a biopsy.
All right.
Okay.
What's the next diagnostic?
Okay.
X-rays, right?
So X-rays are light, no? It's an electromagnetic wave that shoots through your body. Okay, so these X-rays are exposed to a film. So in that film, you will see white and black stuff. Okay, so usually, if the X-ray passed through a solid object, or if it is attenuated much greater, then it is usually turns out white on the film.
Okay.
So these structures include bones, blood vessels. Okay, so those are the usual.
So for X-rays, if you have a tumor, what is good, what is bad?
Okay, we're looking at a tumor using an X-ray. What is bad is solid white. Okay? Circular solid whites. Okay? So that is a character for a bad prognosis.
So black is good again.
Yeah. Why is black good? Because black is usually either water or air. Okay?
Wow.
Because air and water does not inhibit X-ray too much.
Okay. X-rays are expensive?
No, X-ray is one of the cheapest
How much is
imaging. It ranges from 500 peso,
500
even as cheap
pesos.
as
So
300 to
Wow.
1,000.
So 300 plus to 500, maximum 1,000.
Yeah.
For ultrasound, it's 1,000 to 5,000.
Yeah. So
what's next?
okay. So the next imaging modality we have is a much expensive X-ray, which is the CT scan.
Oh, CT
Okay,
scan.
so-
I keep hearing that for cancer patients. They have to go for CT
Yeah.
scan.
Okay. So CT scans have a higher accuracy than X-rays.
Okay.
And the good thing for CT scan is that you can do 3D remodeling. So you know where the tumor is located exactly, and you can do some measurements.
Wow.
Okay, so that is the plain CT scan.
So cancer is always, if a suspected cancer, then most of the time it's a CT scan, right?
Yeah, usually, but it depends on where the tumor is actually. Okay, so for brain tumors, or if your doctor is suspecting a brain tumor, usually an MRI makes more sense.
MRI. So how much is a CT scan first?
A CT scan costs around 25,000 to 40,000.
25,000 to 40,000. Okay,
Yeah.
I know what you guys are feeling out there now, and I will ask Doc Jansen that important question. All right, which I know what you're asking is, Doc, do I really need the CT scan because it's 40,000 pesos? But we will get to that after we finish with the other ways of scanning. So MRI, what is MRI?
Okay, so MRI uses magnets.
Okay.
Okay, so basically how it works is that it aligns your water molecules together so that it produces a sensible picture.
Wow,
of
that's
the inside of your body. So it's really high tech.
That's more science than I understand already.
Now, the difference between CT scan and MRI is that MRI produces a much more accurate picture inside your body. And unlike CT scan, because CT scan is a glorified X-ray machine, no?
Okay.
So CT scan has you get exposed to the radiation, but in MRI you don't. It doesn't have any side effects whatsoever.
Wow.
So an MRI makes more sense in a way since it produces a more accurate picture.
So MRI scan is always better than a CT scan?
Not always. It depends on what you are looking at.
Okay.
Yeah.
So how much is an MRI scan?
An MRI scan is significantly much more expensive to the CT scan, but it's fairly close. It can cost you around 30,000 to 40,000, depending on how big is the scanned area. Okay.
Okay.
So
we have we've gone through the first four already. Next is contrast imaging.
Yeah.
What is contrast imaging?
Contrast imaging is basically the medical staff injecting a dye inside your body so that this dye, when it goes to the tumor, it lights up like a bulb. Okay, so the principle behind this is that every malignant tumor has its own blood supply, right? From our previous show, we talked about it. Yeah,
Genesis.
if you missed it,
Watch on YouTube.
Yeah,
we have it
right.
on YouTube.
Okay, so basically, yeah, a tumor has its own blood supply. A malignant tumor has its own blood supply, so that when the dye is injected into you, that dye goes into the tumor, so that once they scan it, it shows up on the scan. So that's when they know, hey, we are looking possibly a malignant tumor.
So how much is a contrast imaging?
Okay, a contrast imaging is significantly much more expensive than the plain CT scan or the plain MRI. Okay, so it can cost you around 40 to 50,000.
40 to 50,000.
Depending again on what institution you had it done and the location.
And we're just going to go higher and higher, right?
Yeah.
Because the next one is a PET scan.
Yeah.
Again, that's something we keep hearing. If you're a cancer patient, your doctor will ask you to go for a PET scan.
Hi guys, Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. Okay, so a PET scan is a positron emission tomography scan.
Now you know what it stands for.
Okay.
All right.
If you do not know what a positron emission tomography, just Google it. So a positron is basically an antimatter of an electron. So that is the principle behind a PET scan. And the good thing with PET scan is that we uses glucose as a contrast.
Ooh.
So remember, from our previous videos, we took a look, we investigated about sugar feeding on cancer cells. Okay, so now, here is when we take advantage of that phenomenon. So we know cancer cells are highly metabolic. So if they are highly...
They take a lot of sugar.
Yeah, they take in a lot of sugar. So if you undergo a PET scan, your areas of the body which are high in metabolism will light up. Okay? But, of course, having just a PET scan will not really work because we have a lot of highly metabolic organs in our body. Our brain, our liver are really highly metabolic. Our kidneys, that is where the contrast gets excreted. So that will normally light up as well, even your urinary bladder. Okay, so in order for a PET scan to make sense, it has to be correlated with a CT scan.
Also, you have to do both a PET scan and a CT scan to compare.
Yeah, so what you can find in the hospitals and the clinics nowadays is a combination of both. It's a PET CT scan. So why do we need to combine PET scan and CT scan? So the CT scan tells us the space, the anatomy.
Okay.
Where the tumor is located and what the size of the tumor is. A PET scan tells us its function or the physiology. So if that tumor is highly metabolic, then it probably is cancer.
Cancer.
Yeah. If it does not light up on a PET scan, then it is not metabolic. So it's probably a benign tumor.
So if you've done a PET scan already, then you will know whether your tumor is benign or a cancer tumor. So the next time you want to check the size of the tumor, you don't have to do a PET scan anymore. Just a CT scan.
Just a CT scan.
Oh, wow. Okay.
Okay, so another use. So doctors use PET CT scan in what? Of course, it's going to be very expensive. So
how much is a PET CT scan?
A PET CT scan nowadays costs around 70,000 to 80,000.
70,000 to 80,000.
Yeah,
Wow.
so that is the range. Okay, so we know that it's really very expensive. So doctors only use it if we are suspecting metastasis and we want to locate where that metastasis is.
Okay, all right.
Yeah.
And last but not least is nuclear imaging.
Okay, so nuclear imaging, there are a lot of nuclear imaging modalities that we have, but I'm not going to go into one by one because there are a lot. So nuclear imaging basically is the medical team gives you a radioactive drink.
Okay.
You drink it.
You drink it,
Yeah.
like the Hulk.
Yeah.
You drink some radioactive stuff.
Yeah, but you won't get some mutations, okay? So it's entirely safe.
Okay.
The amount of radiation that they give you is really very low. It's really very low. Okay, so when you drink it, that specific radionuclide attaches to the tumor or to the organ that we are trying to monitor. Okay, so once that lights up in the scan, then we know that hey, this is probably a metastasis or cancer.
So how much is a nuclear imaging?
Nuclear imaging costs cheaper.
Okay.
It can cost you around 15 to 20,000. It may actually, depending on the radionuclide they used, it can jack up to 30,000.
Wow. Okay, Doc, let's go to the really important questions that I think our viewers will want to know is, number one, Doc, do I really need to go for a scan? If I do have enough money, is it good to go for a scan?
Okay, so before I answer that question, why do doctors request for these scans? Okay, so number one is, of course, for us to know the size and the location of the tumor. And another one, if it's going to influence our management of your case. Okay, is it going to, once I have this scan, is it going to influence my management? once I have this scan, am I going to do surgery on you? If I have this scan, am I going to prescribe chemotherapy? Of course, those procedures have a lot of risk. So the scan should be justified. Okay?
Oh, so a scan, we because number one, right, guys, we all know that, I mean, for a lot of patients, especially cancer patients, I think the biggest worry when a person gets cancer is, apart from you don't want to, how long we have, is how much is this going to cost me and my family. And I know the first thing that we want to do when we meet so many cancer patients is that how can we reduce the entire treatment cost of cancer? So we always ask this question, do I really need to go to a scan? So Dr. Jansen has clearly shown us the scan is necessary when there's a decision needs to be made to any change in the way the doctor is going to treat you. Doc, before we explore this further, I just want to ask one simple question. Because a lot of these scans use radiation. So apart from the MRI, which has no radiation, the rest I think all do. Is there a limit how often you can do a CT scan? Well, if I do many of these scans, for example, if you do have the finances, you do have the money, it's not a problem. If I do a lot of CT scans, is there a health risk at all?
Yeah, of course, because CT scan uses X-rays. And as you all know, X-ray can cause cancer. It's a carcinogen.
Wow, okay. So even if you have all the money in the world, you want to limit the amount of CT scans that you do. Basically, you do it when you reach a decision point if the doctor's going to change his treatment. He just needs clarity, like surgery. You need to know where the tumor is so that you know where to cut. And we need to know whether you have to up your chemotherapy because the cancer may have spread and metastasized to other places. Doc, then there's a very interesting question. Doc, I know that you always share with our audience a balanced treatment. That means you always encourage them to work with the oncologist as well. But it's also true that there are a growing number of patients for their own personal reasons and beliefs. Maybe it's because of finances, maybe it's really because of their experience. They had other family members who went for chemotherapy, and for whatever reasons they want to go all natural. Or like my dad. My dad is a 2-time cancer survivor. The first time he went for radiation therapy. The last time was about 2 years ago, just before the pandemic. I actually asked my dad, I said, Dad, if you go and test and it's really cancer, what do you want us to do as your children? I said, if you want us to spend all the money on the chemo or whatever, we are prepared, but we just want to know what you want us to do. And he actually told us, this time round, he said, son, the best days of my life are in the past. So my dad is 74 years old, so he actually told us, no, if it's really cancer this time round, he just wants to go natural. I say, if it's his time, his time. So, okay, so for whatever reasons, if the patient decides, I want to go completely natural, no matter how bad my cancer is become, I have my own personal reasons why I don't want to go for surgery or chemotherapy, then in that case, are all these scans necessary?
If you want to know, if you just want to know the size, so then you can go for the scan. But if you want to know the answer to the question, am I getting better, right? Am I responding to treatment? Well, the scan is really not necessary because. Hi guys. Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. If you want to go all natural, then these natural therapies, go for the therapeutic dose, right? So if you're already going on a therapeutic dose, and most of the time, these natural therapies don't really have much side effect like the chemotherapies, right? Because, you only get side effects if you're taking in herbs. But for food, supplements, they don't really have really significant side effects. So the risk actually of taking these the supplements and natural food, it's really low, right? So go for if you are already on a cancer protocol with this, then it's not really necessary to do the scan anymore.
Yeah, because so from what I understand today is this. We go for CT scan so that we know how to control dosage.
Yeah.
Because chemotherapy and other and surgeries, you have to know where the tumor is. So since you're not going for surgery, you don't need to know where the tumor is.
Yeah.
And since you're not going to go for chemotherapy, then you don't need to worry about the dosage. So you just want to use whatever protocol. If you're eating organic carrots, eat as much organic carrots as you can. You can actually save your money because the scan will not
change the way what you're doing now.
Right? But for an oncologist, it's different. They need to know the PET scan so that they know to control or change your dosage.
Yeah, if they're going to increase the dose, so they need to establish that
a reason to increase the dose.
A reason to give you chemotherapy or increase the dose, right? So if your PET scan showed a metastasis, then that's the time. But if your PET scan just showed what? An inflammation or a joint inflammation, then of course that's easily managed by a pain reliever.
Just a pain reliever.
Yeah, they're not gonna put you on a chemotherapy just on that assumption that it is a metastasis, whereas it's not, right?
So that's really good news. I think Doc, really for me, I've met so many patients, and many times even me, I wanted to advise them to go and get a scan. But every time I mention a scan, the patient's face changes. They're like, I can see sweat coming out their eyebrow, and they're just thinking to me. But then they don't tell me. But I know what they're thinking. They're like, huh? Can I don't spend the money for the scan? And today, Doc, you really helped me a lot. So for all the patients out there, this was very helpful to me. I realize now that if you are committed to all natural, you don't actually need the scan because it's not going to change what you do. Because if you are living a healthy lifestyle, the best thing that you can do is live a healthier lifestyle. Eat even more vegetables, right? Drink even more good water, right? Breathe good air, be less stressed. You can do more of that. Do as much as you possibly can, right? So going for a scan won't change anything.
Yeah, it won't change what you are already doing.
Yeah, so if you have cancer that metastasize, you won't. If you're not going to do chemotherapy or surgery, there's nothing new that you just breathe more fresh air.
Yeah.
Eat even more good vegetables. So then save the money and buy your organic carrots, buy an air filter in your house. Get a good trip to Baguio or Sagada where it's less stressful. You can use your money this way. And of course, for patients who are using SimplyNature protocols, you can up from powder to liquid, right? So how would you tell if you are going all natural, right? So so if your body feels, if you feel good, or you feel weaker, then that's the decision point.
Yeah, that's the decision point. But again, you feel this way. Now, the question is, if you feel this way, are you open to receiving chemo, or are you open to receiving other types of treatment? So, what does that treatment entail? So, does that treatment need some information on the status of your tumor? If it does, then you probably need the scan. Okay, so because the protocol for the different staging of cancer is different. So if it is stage 4, then we go for a palliative treatment. And it also depends on the decision of the family if you want to be more aggressive. So then we definitely need to see the scan so we can have a baseline on, hey, okay, this is what I'm working with right now. And after this treatment, I want to know if you responded to the treatment. So we have to document a before and after shot. Okay, so we know, okay, this is how much it changed. This did the treatment work? Okay, so those are the things that needs to be answered, and those questions will be answered by the results of the scan.
So, Doc, thank you very much. I think today's short but very important episode is so important, and I know for all our viewers out there, I know why it's important, because I have a dad that went through cancer as well, and we meet so many cancer patients. So every centavo counts.
Yeah, of
Every
course,
centavo
of course.
counts. Every cent counts. And I've met patients who are so discouraged because they have spent their children's university fund. Or because they had to go for treatment. So
Yeah.
I truly understand the worries that people have. But thank you, Dr. Jansen has given us a very clear understanding. The scans are important when you need to make an update or change to your protocol.
Yeah.
So those of us who are going for chemo, who are going for surgery, please don't save money on the scan, right? You save money on the scan, you cut the wrong place.
Yeah.
All right, you save money on the scan, you take too strong a chemotherapy, and you hurt your body. So if you're going for those protocols, please go for your scans. But for those like my dad, so that's no wonder my dad didn't go for any scan. He just like, it's okay. So he went all natural, and the good news is my dad is fine. Ultimately, we did do one more scan after some time, and it's all clear. So praise God, right? So for those who are going completely natural for whatever reason, the good news is you unless your procedure, unless you're going to do some protocol that requires more information, and your doctor will let you know. But if you're just going to follow on your protocol, and if you feel a little bit worse, okay, then it may not be necessary to go for a scan. In fact, you can then invest your funds on getting even better treatment. You can actually upgrade your protocols to use a stronger protocol that will cost more, but that's where your money can go instead of the scan.
Yeah.
But of course, if you're a cancer patient and you get pneumonia, then you need to go for
the scans, the X-rays.
Then you need to go for X-rays and things like that. All right, but that's so helpful. So today, again, if you have any other questions that you want to ask Doc, if you're after listening to his advice, you're pretty excited, well, you can consult with Dr. Jansen. Just click on the link below, and please give us your feedback and comments. Okay, we'll love to. Dr. Jansen would love to answer your questions and have you consult. And so, thank you, everyone.
Thank you, everyone.